Dr. Jay Bhattacharya, Dr. Martin Kaldorf, Dr. Joseph Freeman, and Dr. Sinetra Gupta. And so before we get into the discussion, what we'll do is we'll give it to each individual panelist. I'd like you to just introduce yourself, say a little bit about your background, and then maybe offer 60 seconds on here we are coming on the 2-year anniversary of the 15 days to slow the spread. And so maybe offer reflection on how public health authorities, bureaucrats, the medical establishment, the media have performed over these last 2 years. And so we'll start with, Joe Lapido.
Oh my. Okay, I didn't know I was going to be starting with this. Well, you guys know who I am. I'm the Surgeon General of Florida. Prior to that, I was a associate professor, tenured associate professor at UCLA, and took care of patients at UCLA Hospital, and had a research program there with NIH-funded research. My life has changed very much over the last 5 months or so, being now in this position, being able to work with Governor DeSantis on what is, very clearly the issue of my lifetime in terms of this incredible challenge or sort of battle we have between, individual rights and individual choice and truth on one side, and really sort of overarching powers, overarching government, abuse of powers, abuse of data, dishonesty, and frankly, a lot of unethical behavior on the other side. So it's been a pleasure to be able to contribute to that, and it's been a pleasure to be here, even though people might think otherwise if they only read news stories. So yeah, the governor mentioned it's our 2-year anniversary. I still remember very clearly when people were telling us that, including a lot of people with a lot of degrees, were telling us that 15 days to slow the to stop the spread, and other really interesting statements. And I remember my wife and I looking at the newspapers and looking at the editorial section of the New York Times, thinking, what in heaven's name are these people thinking? And sure enough, obviously that's proven to be true, that these people had no idea what they were talking about. So we are. I think one thing that's very important at this point is to not let these people get away with it. Is just the best way to put it, because the people that have led us to the point that we are, they want us to forget how we got here, and they want us to forget that their choices that they made for everyone were the wrong choices that basically led to no appreciable benefit. And we cannot let them forget. We have to hold them accountable. We have to let our country, let the world know what the truth is, because it's the right thing to do, and because it can happen again if we don't.
Thank you. Yeah, the good thing about having Joe as Surgeon General, I really don't have to supervise his daily activities. If CNN's attacking him, I know he's doing the right thing, and so I can just use that as my barometer. Okay, we have Dr. Robert Malone. Introduction?
Thank you, sir. My name is Robert Malone. I'm a physician and scientist trained at the Salk Institute and University of California, San Diego, at University of California, Davis, at Northwestern University, and at Harvard University. I'm a molecular virologist, among other things, also taught pathology for over a decade at various medical schools. I've been brought unwillingly onto the public stage because of my role in the late 1980s as a graduate student in a series of discoveries that led to 9 patents, which include all the descriptions and reduction to practice of mRNA for vaccination. So I am both a specialist in the technology. I may be the only one that doesn't have a financial conflict of interest that is in this public discourse right now, but I'm also deeply trained in bioethics and have spent about 15 to 20 years now working closely with the government, particularly the Department of Defense, in the area of biodefense and developing vaccines. So I'm a technology specialist, I'm a clinical researcher, and I'm a bioethicist.
Great. Well, thank you. Okay, Dr. Tracy Hogue, welcome.
Yeah, thank you so much, Governor DeSantis, for having me. It's an honor to be here. I'm a physician in private practice in Northern California and did my residency at University of California, Davis. I did my PhD in epidemiology and public health at the University of Copenhagen. I'm a Danish-American double citizen. I'm a mother of 4. I bring a little bit different perspective to this, staying up to date with what's going on in Scandinavia and having children and being in practice and seeing patients. I was brought here, I believe, mostly because of the research that I've been doing since essentially the beginning of the pandemic on COVID spread in schools among children and published in MMWR in pediatrics and COVID-19 vaccination in adolescents, which was just published in the European Journal of Clinical Investigation. And because I'm in private practice and an independent researcher, I've been able to speak up freely about the findings of our studies. And so I'm here to sort of speak about these findings and the importance of academic freedom and open discourse. And so I'm really excited to hear and learn from everyone here from their particular points of view and backgrounds. So.
Thank you. Okay, Dr. Jill Ackerman.
I'm Jill Ackerman. I'm a family physician, earned my medical degree at the University of Kansas, completed my family medicine residency at Mayo Clinic. I believe my role today is valuable because, like 3.5 million other women, I retired during this pandemic. I retired in October of 2020 so that I could focus on being a mom to the 4 most amazing children on the planet. Another important role I took in October 2020, I began speaking out about the prolonged school closures and the harmful and unproven restrictions on our children. I really appreciate the opportunity to be at this table to listen and to learn and to hopefully hear how we will recalibrate so that when we move forward, we can protect our children from some of these harmful restrictions.
Thank you. Okay, Dr. Christopher Diadamo.
Thank you, Governor. My name is Chris Diadamo. I am on faculty at the University of Maryland School of Medicine, where I direct the Center for Integrative Medicine, and I'm also a fellow at the Nova Institute in Baltimore. I'm an epidemiologist by training, and my work has covered pretty wide ground, but I've focused predominantly on the associations between modifiable lifestyle factors and human health. Things like physical activity, nutrition, dietary supplementation, stress management, sleep, time in nature, even these types of things. And I've covered the lifespan, my team and I, from children and adolescents, which we're going to be talking about today, to older adults in the study of aging. But the work that's been, I'd say, the most meaningful to me during this time, the most rewarding, has been our work with underserved children and adolescents in Baltimore, where we've done school-based nutrition education interventions. We've done modifications to the meals in the National School Lunch Program. We've done physical activity interventions, mindfulness interventions, and even a urban farm summer program that we've done. And this is of great relevance to today's conversation because these types of behaviors help prevent the chronic diseases that increase the risk among children, which otherwise is very low when it comes to COVID. And I'm happy to be here. I also want to express my appreciation to Dr. Ladapo and the Florida Department of Health for being the only public health agency, to my knowledge, to talk about lifestyle and behavior and the profound impact that that can have on COVID severity in children, adolescents, and adults. So thank you. It's a pleasure to be here.
Thank you. And he was criticized for doing that by the media, of course. I remember that distinctly. Okay, Dr. Raju.
Thank you, Governor. My name is Dr. Shweta Raju. I'm a primary care physician practicing now in my 12th year. I attended medical school at Emory University. I finished in 2007, and then I did internal medicine residency at Massachusetts General Hospital, which was completed in 2010. Over the past 2 years, I have prioritized diligently keeping up with the literature related to COVID-19, the scientific studies that are published and often not published or widely promoted in our mass media. I've used this knowledge to inform my practice as well as my family and my community. We have striven to continue to provide routine preventive care, chronic care, as well as care for acute illnesses for all of our patients throughout this time, including providing COVID-19 testing in their primary care office as early as possible, which was in April of 2020. Further, we participated with our local Department of Health in COVID-19 vaccinations from January of 2021 until May of 2021 and vaccinated thousands of patients. And I'm sincerely grateful to both the Surgeon General and the Governor for inviting me today, because I really do think we have an opportunity to improve communication, not only around the illness of COVID-19, but also on prevention of severe outcomes, as well as the effectiveness of our mitigation strategies. I think it's incumbent upon us to review and reflect upon the last 2 years and determine what actually worked, what didn't work, and this will ensure the integrity of our profession going forward. I also believe that we can have a turning point to refocus our care on the overall wellness and mental health of our patients. Thank you.
Thank you. Okay, now to our virtual participants. So we'll start with Dr. Harvey Reish.
Good morning, Governor and colleagues. Thank you for having me on the panel. It's a pleasure to be with you. I'm Harvey Reish. After medical school, I went and got a PhD in mathematical modeling of infectious epidemics at the University of Chicago, and then I did a postdoctoral fellowship in epidemiology at the University of Washington. And since that time, I've been a professor of epidemiology, first at the University of Toronto and for the last 30 plus years at Yale. 2 years ago, at the beginning of the pandemic, since I'm a member of the Connecticut Academy of Science and Engineering, I was tapped to be on a committee to advise the governor about out-of-the-box ideas about reopening the state after our lockdown. And my task on the committee was to look at early outpatient treatment. And I got into that, and there were so many discrepancies about what the science was saying, as little as it was then, compared to what the public messaging was, that I thought that people were being sloppy, and never did I realize at the outset that there was a systematic reason for misrepresenting the science. But I ended up publishing in May of 2020 a seminal paper on early outpatient treatment that had 150,000 downloads or something like that, and has been criticized, but is actually shown to be quite accurate with subsequent studies that have shown the efficacy of these various generic medications that have been under a major campaign of suppression by government and other agencies that have pushed even the discussion of these medications out of the Overton window. Nevertheless, that are telemedicine groups and other clinics in the United States have treated more than 200,000 people with these medications so successfully that less than two dozen people have died out of that large number of treated patients. So I've basically maintained a commitment to keeping this discussion open, in addition to other things about COVID as I understand them from my epidemic modeling days. And I appreciate the opportunity to be able to address all of you today on these topics.
Thank you. Okay, next virtual participant, Dr. Jay Bhattacharya.
Hi, Governor. Thank you for having me. I'm a professor of medicine at Stanford University. My name is Jay Bhattacharya. I've been at Stanford since I was 18, basically. I've been here for 36 years. I am trained as a physician and also as a health economist. For the last 20 years, I've been studying infectious disease epidemiology. I wrote, one of the earliest things I did in the pandemic was a study on how widespread the disease was in April of 2020 in California, in various cities in California. And what we found was that the disease was already quite widespread, even as early as April of 2020, maybe 3-4% prevalence. It was already too late for the lockdown-focused strategies we adopted to get the disease to zero or to eliminate the disease. The lockdowns that we adopted to address the disease ignored a basic fact about it, which is that there's a 1,000-fold difference in the risk of severe outcomes from infection, with the youngest being relatively well protected, thank God, compared to the old. At the same time, the harms of the lockdown have been absolutely devastating, catastrophically devastating to the poor, the working class around the world. Children, especially poor children, not in Florida, but many other places, have been left out of school, and in poor countries, in some cases for over 2 years. Or almost 2 years, and the harms to the health of the population from the lockdown focused strategies, which have really relied on fear and induced panic, have caused catastrophic harm that we're going to be paying for decades to come, I believe. In October 2020, with Martin Kulldorff and of Harvard, then of Harvard, and Sunetra Gupta of Oxford, both of who were on the panel, dear friends of mine, we wrote the Great Barrington Declaration, arguing for a very different strategy, where the idea was to take advantage of the fact that children and young people were relatively well protected while the older populations was actually vulnerable. So we argue for a strategy of focused protection of the old and the vulnerable, while protecting the young by lifting the lockdowns. The lockdowns have caused much more harm to the young than the benefit that had from whatever protection against COVID. And so we viewed the lockdowns themselves as immoral. Places that have followed such a strategy, Florida, Sweden, other places around the world, have done much better in terms of overall health outcomes than places that have had lockdown-focused strategies where the disease is spread anyways, but the catastrophic damage to the poor, working class. So going forward, my goal is going to be to help people understand that the lockdowns were an enormous, catastrophic mistake that should never be repeated. I believe that lockdowns should be seen as a dirty word, that when we think about lockdowns, we should recoil with horror, because what is the policies we followed have violated not just medical ethics, but also it's crushed the ability for scientists to discuss openly with each other facts and evidence. It's taken a great amount of effort, willingness to face abuse in order for scientists to speak up, and many have been silenced. So I think the restoration of the freedom for scientists to discuss with one another openly what the evidence actually says, without this fear of repression that we've seen during the pandemic, in order to support the lockdowns, needs to end. I think that the proper place of science in society needs to be restored, so that scientists can advise but not dictate policy. And I believe that lockdowns themselves, once we have fully evaluated them, will be seen as a enormous mistake. So, and I hope so that we could, with my work, so that we never repeat it again. Thank you.
Thank you. Okay, Dr. Martin Kulldorff.
Good morning, everyone. Thank you for inviting me to this panel, Governor. My name is Martin Kulldorff. I am an epidemiologist and a biostatistician, and I'm a former professor of medicine at Harvard Medical School. I'm now the scientific director of the Brownstone Institute. I think after the experience of this pandemic, we have to build up new scientific institutions in order to save public health and science. I think I'm probably the only person who have been fired from the CDC from a CDC committee for being too pro-vaccine. I was fired about a year ago because I was arguing that we should not do a pause on the J&J vaccine for older adults. I think the most stunning, among many things, is a big competition, but I think the most stunning thing that happened during this pandemic from a scientific point of view has been the questioning and the denial of national immunity after having recovered from COVID. It's universities and hospitals who should know better have demanded vaccine mandates for people who have already had COVID, and have fired people who have recovered from COVID, despite having better immunity than those who are vaccinated, with less than probability of passing on the COVID to others. So that goes against basic principles of public health. And to have a director of CDC who questions national immunity, which we have now, is sort of akin to having a director of NASA who questions whether the Earth is flat or round. It's just It's just mind-boggling that we have come to a situation like that. So I'm looking forward to participate on this panel and enjoy the discussions. Thank you so much.
Okay, thank you. Okay, next we'll do Dr. Joseph Freeman.
Thank you, Governor DeSantis, for inviting me here. As you said, my name is Dr. Joseph Freeman. I'm an emergency physician. And in fact, I'm right now between night shifts, so I apologize if my lack of sleep is going to disturb my communication abilities. But I work in rural ERs in Louisiana, in what most would call Cajun country. I love working with my Cajun nurses and my Cajun patients. I graduated from Cornell Medical School and did my emergency medicine training out in Charity Hospital in New Orleans. In addition to being an ER doc, I'm a clinical scientist with my main research focusing on analyzing clinical studies, specifically understanding their methodology and interpretation of harm-benefit analysis there and through the data that they provide. I do not work in a fancy academic center. In fact, I don't work in an academic center at all. While I acknowledge it's a strange path for a clinical researcher, I chose this path so I would have control over my research and not have administrators dictating what I can or can't research or what I can or can't state publicly. And I'm here today partly because of that lack of affiliation that I had chosen to take in my path, not because I planned that this event would happen, but because, as we know, most people who are qualified to analyze the clinical studies and speak about them publicly, most of these people work within these academic centers. And many of these are my colleagues, and they are concerned that if they were to speak publicly, express their opinions on COVID-19 and on all sorts of range of things, they risk losing their jobs. So I would like to applaud all of our academics here who are brave enough to show up. And honestly, they've been risking their jobs throughout this pandemic and throughout this, I would call it a dark period of scientific censorship. And I would call you all heroes for doing that. So the fact that many of our best and brightest physicians and scientists have been too scared to simply speak out to the public and tell them their legitimate scientific interpretation of data is something that I think just should startle us all. Today, I value that we have this forum as an opportunity to be able to publicly state what many of my colleagues do not feel that they are able to. Thank you.
And then finally, but certainly not least, we have Dr. Sunetra Gupta.
Thank you, Governor, very much indeed for inviting me to this panel. It's a real honour. So who am I? I'm at Oxford. I'm Professor of Epidemiology. My primary skills are in mathematical modelling, which I actually acquired, 35 years ago now, when I was an undergraduate at Princeton University. So that's where I started. And then I moved to the UK and did a PhD in epidemiology, also mathematical modelling, at Imperial College. But then more recently, I've become more involved in vaccine development and immunology. So I'm just saying so because there has been a lot of criticism leveled at some of us in respect of what our actual specialties are. Anyway, I mean, much of what I would have wanted to say has already been said. I guess one point I might make is that it seemed to me, when I was thinking about how would you crystallize what's happened throughout these 2 years, it seems to me that there's been a sort of inversion of the schedule of uncertainty, as I call it. So right from the start, everyone, or the powers that be, were saying that these measures, lockdowns and other restrictions, will work. And the truth is we didn't know whether they would work or indeed what the purpose would be. for, even if they did work, where was that taking us? And then there was a lot of doubt that was cast unnecessarily about the nature of the virus and how it would evolve, which was unnecessary given that it was a coronavirus, and we knew full well what the likelihood was of it evolving to be something different, or whether there would be herd immunity to it at all. All of these issues which were thrown out as unknowns weren't unknowns. The one thing we did know was that the measures we were proposing to implement, lockdowns and other restrictions, would have enormous cost. That was the one thing we were certain about, and yet that's what we went ahead and did. So we inverted the precautionary principle, if you like, of trying to minimize harm by doing the one thing that we knew would cause harm. 2 years, now we can say, the benefit of hindsight, that the measures, in fact, didn't do very much to slow down the spread or whatever it was that was, whatever rather, incoherent set of goals they thought these particular practices might achieve. And what we do see very sadly is that what we knew right at the start, that these measures would cause harm, that has in fact unfolded in front of us. And that's where we sit now, is watching the devastation that we knew these measures would cause 2 years ago. Thank you.
Thank you. We really appreciate and we're excited to have so many renowned scientific experts with us here today. And thanks for helping put this together, Joe.
Thank you, Governor. So the purpose of us coming together today is to have something that has been missing and been hard to find over the past 2 years, which is open discussion and transparency about some of the policies that we've seen over the last 2 years. So some of these topics are going to be controversial. Our goal is truth and transparency. I know that the audience is going to find that refreshing because it's been so hard to find. So just to name a few of the things that we're going to discuss, we're going to talk about mask mandates and lockdowns and what the evidence looks like in terms of, what do we know about benefits? What do we know about harms? We're going to talk about COVID-19 vaccine mandates, particularly for children. What do we know? We're going to talk about some of the recent very nice footwork that the CDC's been doing in terms of some of the guidance changes we've seen very recently, timed very interestingly. And we're going to talk about boosters for adults and children. What do we know? What do we know about benefits? What do we know about potential harms?
Well, in Florida, I think, and I see this through all the, there's different themes from what everyone's already said. And really, I think what we've seen over the last 2 years is a gap between the overarching narrative, a gap between the Faucian pronouncements of what needed to be done, and then the actual data that supported or did not support those policies. And so there was time and again where the data would diverge from the Fauci pronouncements or from the corporate media or the medical establishment, and in Florida, and whether that was, having businesses open, whether that was having kids in school, whether that was about mandating cloth masks, whether that was about mandating vaccines, we always sided with the data and rejected the narrative, and that is something that I think was something that's very, very significant. Our state is kind of like the center of the world over the last year. Everyone wants to come here. We've never had more people moving in. It's hard to even find property now. And I think it's because people wanted to go to a free society. They wanted their rights respected, but they appreciated that, we were honest about the data. We were also honest about what government could or could not even do in terms of arresting a very highly contagious respiratory virus. And so, time and time again, though, in other jurisdictions over the past 2 years, with the lack of data to support it, we did have our medical establishment and politicians push repeatedly for these policies, which we know have been ineffective. And, we also know they've been ineffective because the first chance they get to violate their own policies, oftentimes they would do that.
Yeah. At least it made for some entertainment during the dark days of lockdowns and other new mandates that we were hearing about. some of these politicians who were visiting the state, I believe, oftentimes outside enjoying the Florida sun, or having a nice dinner at a nice restaurant when everyone else was supposed to be at home and wearing their masks. So thank you to the politicians for at least giving us some entertainment along the way. So, just like you said, Governor, we've had a lot of people with great degrees hang their reputations on the false statement, and I say false based on what we see in terms of the data, that the lockdowns or the mask mandates or the vaccine mandates would be a cure-all. And you look at the data, these things go around on the internet, and you sort of look at the rise in cases and the fall in cases of different locations in this country, outside of this country, that have implemented different mandates. And, if there's a difference, if there's an appreciable difference, I'm yet to see it. And that's been the reality.
Yeah, and we'll start here in a minute with Dr. Malone, but I think one of the interesting things throughout this is that if there was a study, like Jay Bhattacharya, what he did at Stanford very early on, you really had to fight hard to find that and find discussion of that. If you have studies where there's no benefit for masking young children in school, that was not something that corporate media outlets wanted to discuss. When the Danish mask study came out for the general public, and so it showed no benefit, that was not something that was discussed. And so what we had to do in Florida was really work hard to find the actual data, look at the studies, and consider those regardless of whether the media wanted to. But then if there was something that was kind of half-baked that supported the narrative, there would be blaring from the headlines about how important this is. I mean, things like saying that, the pandemic could end in 6 weeks if 90% of people just wore a cloth mask, and all these other things that were constantly trotted out with very little actual rigor behind them. And so when you look at the policies, and we'll start with Dr. Malone, I mean, obviously there have been a lot of failures of the policies. How do you reflect on that? What has been effective? What hasn't? And what does it say about the overall medical establishment that people who wanted to dissent from those policies and were right were nevertheless treated very poorly?
Well, that's kind. Thank you for teeing that up. And I don't whine about what the press has subjected me to or my colleagues. One thing I did want to mention is I'm here representing the International Alliance of Physicians and Medical Scientists, which is over 17,000 physicians and medical scientists. It's the source of many of these folks that are here on your monitors. And I'm grateful for the opportunity to represent them, and also to represent the Unity Project, which is a California-based organization that is opposed to the mandates for children that Governor Newsom, who, if there's a contrapositive to yourself, I would say we'd have a coin toss between Governors Newsom and Inslee. So congratulations, particularly on the immigration from my old home in California here to the free state of Florida. But in terms of the policies, the International Alliance has made a series of very clear, unambiguous statements. There is no justification for mandating vaccines for children, full stop. We're of the strong opinion that if there is risk, there must be choice. This is fundamental medical bioethics 101. Number two, as far as we're concerned, there is no medical emergency now, and there is therefore no justification for the declaration of medical emergency and the suspension of rights that has occurred with that re-upping of the medical emergency by the executive branch, let's say gently. Our opinion has been that the hunting of physicians and the restriction of physicians' ability to prescribe and treat with early treatment. Another thing that the state of Florida has led on that we're very grateful for is enabling physicians the latitude to provide early treatment to patients. We have really tried to advocate for the ability of physicians to just practice medicine.
Why the hostility to that, though? I mean, we had different There were generic drugs that people talked about, very hostile response to that. But then even things that would get EUA from the FDA, like the monoclonal antibodies, you never heard Fauci talking about that at all. We started doing it in Florida, and we were criticized for it. So why, it was almost like lockdown mask until there's a vaccine, and there was hostility to even discussing the idea of early treatment.
So in order to answer that question, I have to get into Tony Fauci's head and that of Rochelle Walensky, which I refuse to do for a number of reasons. So I could only speculate, but the observation has been repeatedly made that technically the emergency use authorization clauses, which have been what has been used to authorize these vaccines, and to be clear to everybody, there is no licensed vaccine available for purchase and use in the United States. The licenses that have been provided are for products with labeling that don't exist in the United States. Those manufacturers are not distributing that. So the only thing that your school children in your state has available in terms of vaccines is still emergency use authorized products with all of the associated liability, waiver, protection, etc. But without going down into conspiracy rabbit holes, the most straightforward explanation of the behavior is that the emergency use authorization clauses require that there are no other alternative treatments available. So the speculation is, and there are data information supporting this, for instance, with Janet Woodcock and hydroxychloroquine and Rick Bright, videotaped evidence that there was an intentional effort to circumvent the will of the President of the United States, who had specifically requested and required that hydroxychloroquine be made available on an outpatient basis. And there was an intentional decision on the part of Janet Woodcock, who then became acting director of the FDA, who at the time was leading Operation Warp Speed for Drugs, together with Rick Bright, who was the head of BARDA at the time, to make it so that physicians would not have access and not have authorization to hydroxychloroquine, an agent which the Chinese government used for treating COVID, which had a long documented history of utility as an antiviral, and which had demonstrated effectiveness for SARS-CoV-1 back with that prior experience. So I thank you for the question, Governor. I don't know what goes on in Dr. Fauci's head, and I don't know about the Byzantine, even though I'm a government specialist. There's a lot of this stuff that goes on behind closed doors. We use phrases like deep state, but the truth is that there was clearly an intention on the part of key decision makers within the government hierarchy within Health and Human Services to prevent physicians from being able to administer repurposed drugs, of which there are many, which can save lives when administered early. Pretty much there is a huge laundry list of anti-inflammatories and other strategies which, when administered early, absolutely will save lives.
And Dr. Risch, you had mentioned you were involved in this very early on. What type of response have you gotten when you're discussing things that depart from some of the mitigation strategies or a compulsory vaccination regime?
Well, it's interesting that there's been a lot of misdirection from what we've seen. We put out our scientific understandings and evidence, and then we get criticized on things that we didn't say. And I think part of the problem has been that what's been purveyed to our society is plausibility, but not science. There's a big difference between things that seem plausible and things that are scientific. And so lockdowns are plausible, but they're not scientific. And the scientific evidence, as we've seen, is how harmful they've been. The same has been true for the medications, that hospital studies have shown lesser effectiveness of hydroxychloroquine than outpatient studies. Nevertheless, the FDA put up a huge warning webpage saying, warning hydroxychloroquine should not be used for outpatients, when it had no data on outpatient adverse events. It only had data on hospital events. And hospital COVID is a totally different disease with different symptoms, different outcome, different treatment. Nevertheless, the FDA put up this warning, which is still there today, that frightened doctors across the world from using hydroxychloroquine and provided impetus to pharma regulatory boards and medical regulating boards to prevent doctors from prescribing hydroxychloroquine, in spite of the fact that there's now 10 studies showing how effective it is in reducing mortality risk. But one thing I want to say is that and apropos of what everybody else has been saying about mandates and the fact that we're not in a state of emergency. In fact, Dr. Ladapo mentioned early on that we have a tension in public health between protecting the community and individuals' maintenance of their inherent rights. That's a tension that has to be negotiated in each instance. But that tension relies upon a compelling government interest to withhold rights in the favor of the public health. Nevertheless, we know that there has not been a compelling government interest because we know that, for example, every year in the United States, 500,000 people die from tobacco-related diseases. That might be a compelling interest, but the government has never made any serious attempts to deal with that problem. And it's certainly a lot more than what we've seen from COVID, let alone in the Omicron era now. So there is no compelling government interest to maintain a heavy-handed emergency order that limits people's fundamental rights. And so the fact that it's doing that and continuing that is an abuse of our constitutional rights, our inherent rights.
But I think it's a good point because if we were 3 years, if this was 2019 and you had talked to me about the medical community, I would not have viewed the medical community as a threat to my rights. I think a lot of Americans now do, particularly public health and those bureaucracies, as a threat to their individual rights. And so as we have kind of the reckoning of some of the failed policies, there's going to be a lot that needs to be done to try to regain any bit of trust in terms of that. Did you want to speak on any of those issues?
Absolutely. And I come at it not from the public health perspective, but just from the individual patient-doctor perspective. And it is very difficult when you're talking to a patient and right between you there's a mandate. So it definitely has affected the relationship in so many ways. And as I mentioned earlier, I would really hope that going forward we can refocus on meeting the patient where they are, understanding their concerns, answering their questions, focusing on their overall health, metabolic health, making sure that they're getting routine preventive care that's appropriate for their age, and their mental health. And there's definitely been better media attention on the mental health of children, but the mental health of adults has been greatly affected as well.
Yeah, absolutely. Dr. Hogue, you did a study on mask mandates that was a little bit counter to what the prevailing wisdom is. So can you talk about that study and then kind of the response to it?
Yeah, absolutely. So I guess there's two different studies that I've been involved in that have looked at masks, and I want to talk about the first one because it's often cited as a rationale to mask children in schools, which was a study from Wood County, Wisconsin we had published in MMWR, and there was a mask mandate in place, and we had estimated 92% compliance among the children during the time of that study, fall of 2021, and multiple school districts in Wisconsin, and we found minimal spread within the schools. We found 37% lower case rates in the schools than in the community, and only 7 children throughout the fall caught, in over 5,000 children caught COVID in the schools, so no teachers. And so that was used as evidence that masks worked. So I think we need to talk about the type of evidence that we use to do things, and that there was no control group in that study. So that's just elementary, that you need to have a control group. So it would be like saying because the kids in Wisconsin were wearing pink socks that they, got less COVID, they spread COVID less. But we actually had a control group in Scandinavia, as you know, and in Florida, and there was minimal spread in the schools in Scandinavia, and a Norwegian study that was done at the same time. But that was ignored. Secretary Cardona used it as an example. The media used use it as an example of this is evidence that masks work because the mandate was in place. Now we know it's slowing the spread of COVID, when really it could have been any number of things. And so, you know, when we look at the evidence for masks, we have 2 randomized controlled trials, which is the highest form of evidence. And we know that according to the Dan Mask study, that they did not identify at least a 50% benefit to the wearer. And we know that according to the Bangladesh study, that cloth masks were ineffective and surgical masks had a very small effect on people over the age of 50 and no one under that age. And that was in the context of an increased amount of distancing in the surgical mask group. So basically now we have 2 studies, the highest quality evidence saying that mask mandates, especially cloth mask mandates, don't work. And just like Dr. Gupta said, we've really had an inversion of the precautionary principle. And I think that's a great theme because it relates to school closures, lockdowns, masks. You know, we know that masks interfere with communication. The children do not like wearing them. The children with hearing impairments and other impairments have difficulty wearing masks. And yet we're forcing them to do this just because we have this idea that they're going to be doing something good. And we have actually no high quality evidence showing that they are.
Yeah, and the media would cite studies. I mean, I remember when we were having this fight, we had school districts masking kids. We liberated them from it. And they would cite out these studies like North Carolina. Oh, the mask worked. No control group at all in the study. And they're citing this as like, this is conclusive proof. And, you know, you didn't really even need to do a clinical trial to look. If you have neighboring communities where one school system is masked and the other isn't, and there's no appreciable difference, that's pretty good evidence that this is not something that's really making a big difference as an intervention. But some of these interventions can cause harm. So Dr. D'Adamo, especially with children, lockdown, school closures, forced masking. People would talk about all that in relation to stopping the spread of COVID or not. Obviously, I think most of us think it was ineffective. They rarely would talk about, you know, what the harms would be. What did you see?
Well, I mean, I think before the implementation of any sound public health policy, you need to do a comprehensive systems level risk-benefit analysis that looks at the intended outcome, but also other positive outcomes possibly, and collateral damage. And I think when we look at these school closures, the collateral damage outweighed any benefit that was gained out of it. Proponents of the school closures operate on the assumption that, you know, in-school learning was going to be a major vector for transmission of COVID, you know, to teachers and staff, among other children. And many on this table, I think, did not operate on that assumption. Many other countries, Sweden, some others that have been mentioned, did not operate on that assumption. And the data that have been published since then have revealed that there's minimal, including some of the work that Dr. Hogue was involved in. You know, 5% at most, it seems, from a lot of the published data of COVID was actually spread in schools. Some studies as low as 1%. And some of this used pretty elegant contact tracing. So what we do know is the collateral damage was real with this for both physical health and mental health. So on the physical side, we've seen, you know, when you're out of school, you're not getting recess, you're not getting physical education, you're not getting sports, dance, just general moving from class to class. We have seen, and this likely contributed to the increases in BMI and obesity, a doubling of the increase rate of BMI during COVID. We've seen a doubling in some places of the incidence of new diabetes, type 2 diabetes cases. The physical health is one side, mental health too. We've heard a little bit about this already. You know, when you have social isolation, when you're away from your friends, especially at such a formative age like that, even more screen time, you know, kids are already on their screens a ton. We've seen increases in anxiety, depression, stress, which is one of the ultimate ways to impair the immune system is to be stressed. And this has resulted in, you know, contributed to at least, you know, we've seen increases in emergency department admissions for mental health related conditions. We've seen increases in suicide, dramatic increases in suicide ideation and so on. So, you know, I think it's pretty clear at this point that the collateral damage outweighed any benefit that was there. And these conditions that I talked about, these chronic diseases, published in Journal Pediatrics, JAMA Open, a recent systematic review of meta-analysis in the Lancet journals, these chronic diseases increase the risk of severe outcomes among kids who otherwise are at very little risk. So I think we just need to take that more systems level approach before embarking upon this kind of policy the next time.
Dr. Ackerman?
Yeah, so as the parent at the table, I saw that firsthand, obviously. I hate to make this personal. Anecdotes sometimes are important, though. You know, my 9-year-old saw a reduction in academic scores, math and reading. My 12-year-old literally became addicted to screen time. My 16-year-old is a wonderful introvert, but the social isolation certainly affects children that tend to be introverts. And my 17-year-old, you know, that age group, they oftentimes just opted to not even log in. So I'm just pleased to see the shift and that we can now acknowledge that perhaps our children are not as resilient as we most often heard that they were. And just, again, hope that this recognition, we can move forward and prevent this from occurring in the future and recognize schools are essential. We really, we left that core principle in the dust over the past 2 years.
Absolutely. Jay Bhattacharya and then also Martin Calder and Sinatra Gupta, we did a similar event like this about a year ago, and they all three said kids needed to be in school, they should not be forced to wear masks, and basically things that now even the CDC has come around to. That video was taken down and censored by YouTube and by Google. Just so you know, we are putting this on YouTube, and we're going to see over/under on how long they keep it up before they take it down. But it's just interesting. So many of the things they've censored have turned out to be now accepted wisdom. But Jay Bhattacharya, can you talk about harms, particularly with respect to lockdown policies on children?
Yeah, so almost from the very beginning of the epidemic, we adopted policies that seemed like they were tailor-made to harm children. Throughout the country, schools closed in the early days, and in many places, schools stayed closed. The harms were particularly bad for poor kids. Richer parents sent their kids to private schools, hired tutors, had pods, but poor kids didn't have that luxury. And for full 18 months, many all they had access to was remote. Not in Florida, of course, which I'm grateful to you, Governor. The effect on these kids has been catastrophic. One study just from the spring lockdowns in 2020 estimated that our kids would lose 5.5 million life years. And so let me unpack that a little bit. How can skipping school lead to life year losses? Well, it turns out schools are among the best investments society makes. When you skip schools, when you reduce our investment in schools, and when you essentially force kids to lose learning, that has ripple consequences for their entire life. They will lead shorter, unhealthier, poorer lives as a consequence of those decisions made, especially poor kids. And around the world, the decisions made in the United States and elsewhere has consequences on and a huge amount of influence on places like like Uganda, like India, where schools have stayed closed for 2 full years. We have essentially robbed a generation of children with a birthright. The consequences of this have continued with masking. We're still masking in some places in the United States toddlers. The CDC is the only public health agency in the world recommending that toddlers 2 to 5 years old still be masked, with literally not a single randomized study of any sort or any credible study of any sort showing that it has any consequence on the spread of the disease. The only reason why they continue to mask them is because they're powerless. So I think we have adopted this idea that children are the central problem. Children are the ones who should bear all the burden of infection control, when in fact it's not true. It sort of has revealed the values that we have as a society. It's not a pretty picture, and you can see none of this stuff has actually worked to protect the vulnerable. There's still 80% of the deaths have been people over 65 in the U.S. and in the world. What have these restrictions on children bought us? Not very much, if at all, and they've caused enormous harm that we're going to have to address for years to come.
Yeah, you'll have situations where all these people, and I have no problem with this, having a great time at like the Super Bowl. The politicians all having a great time at the Super Bowl. No one's wearing masks. They're just living their life, which I support. But then the next day, that Monday morning, you got 5 and 6-year-old kids that have to wear a mask 8 hours a day in the school right down the street from where the Super Bowl was held. It's unbelievable that so much mitigation has been focused on the most vulnerable, voiceless, and really not only less at risk from the disease, but I think it's been shown they're less likely to transmit it to people than a symptomatic adult would be. Dr. Gupta, how is this from your vantage point over in the UK? I mean, I know there have been some lockdown policies. Some European countries, I think, have been more sane than the United States. But in terms of, is there a recognition in Europe and in the UK that these policies were harmful, or are they still trying to justify it and saying that it was right from the beginning?
I think the notion that they were necessary is now really starting to crumble, and there's been widespread acknowledgement that they didn't do what they were meant to do. So they didn't do what they said on the tin. But beyond that, it's also starting to become clear that even if they did stop transmission, that wasn't necessarily going to take us. What was the end point? One needs to, in considering implementing these policies, you really need to think beyond just the simple fact of might this prevent transmission or not. What is the purpose of that? Now, of course, we had the sort of zero COVID crowd who at least, one has to say, had a sort of rational argument, deeply flawed, but rational, that, okay, you use these measures to completely get rid of COVID. There was a pipe dream, and the way they defended it was very disturbing. But if you're not going to do that, then what is the actual end point? And there's, I think, starting finally to be a realization that it's not even about whether the school children transmit or not. It's just where do you go in muzzling them and stopping them, causing them harm? What exactly is the benefit that you're conferring to society? And I think that's become much clearer. But I will say, I think overall there has been much more of a reluctance to impose on children some of these measures than I've observed with horror in the United States.
Thank you. Okay, Dr. Freeman, just from an ER perspective, what have you seen throughout COVID as U.S. jurisdictions had lockdowns, school closures, and then what were your options as a practitioner in terms of treating these patients? I can't hear you. Can you unmute it?
I'm sorry.
There you go.
I got it now. I'm sorry. In contrast to actually what a lot of the voices here, my perspective throughout the early parts of this pandemic were very different than theirs. But I think that sometimes maybe when you're similar to maybe like at a movie, when you have the front row, you can't necessarily see the whole picture. For example, in the first wave, my nurses and I, we saw so many people dying from COVID. It horrified us. It was more death than any of us had ever seen. Freezer trucks at our door, holding the bodies that for the leftover, from that our morgue couldn't handle. At that time, the only thing I could see was we needed more aggressive COVID policies to get this plague under control, stop these deaths from happening. I was confident that all of the locations that didn't embrace this like aggressive COVID policy, they were going to suffer tremendous deaths. And what we would see next is then, of course, what would follow is they would see how much death they suffered, and it would become so painfully obvious that they would adopt all the aggressive policies. But I was wrong. My views were wrong at that time, because the states and nations that didn't take aggressive COVID policies, they didn't do obviously worse. It took me about a year into the pandemic before it became really clear that it wasn't obvious at all that any policy was strongly effective at reducing COVID infections or death outside of within the island nations, where clearly border control looked like it did have a pretty strong effect. So the scientist in me had to take this emerging data that I was seeing and acknowledge my hypothesis had been falsified, I guess you can say. And the COVID policies that I was so certain were necessary, they just didn't help the way that I would hope they had helped. And then I realized something that I kind of ignored, that, you know, much of the people here have discussed and brought up, which is that these policies were harmful. Initially, I don't want to say I was ignorant, but it was irrelevant because there were lives on the line. I'm an emergency doctor. There's lives, you know, and it's like, no, we have to do it. But if the policies didn't make a big difference and they only caused harm, then you have to start rethinking what we're doing. And you have to take the data that's clearly in front of us. And if it is only causing harm and at best can only save few, we need to think about it, because if at best, right, an aggressive lockdown policy, imagine it reduced hospitalizations, death by 20%. 20% of deaths, hospitalizations reduced. If that was the case, then maybe we could come here and debate, is the harms that are caused by those lockdowns worth that benefit? And how do we negotiate that benefit through, you know, navigating through our freedoms? But the reality is hospitalizations and deaths were not reduced by 20% by any policies. And because if they were, we would have had studies at this point that would have been able to consistently identify that. And that just has not occurred at all. So I think as a society, we have to decide if we want to continue like a public policy that's obviously producing large harms and offering only a minimal benefit at best. That's currently unmeasurable. Also, personally, I would like to apologize to the 3 other scientists sitting with me here on Zoom, the proponents of the Barrington Declaration, because initially I did think y'all were crazy or dumb, or maybe you just didn't understand what I was seeing. But I now realize, actually, I'm sorry, because I believe now you guys were correct, and you were correct from the beginning. And I wish that more people, including myself, had realized that sooner. And I hope more people realize that soon enough.
Thank you.
Oh, thank you, Dr. Freeman.
Yep, that was great.
And, you know, so many very important things you hit on there. So one of those things is that you've demonstrated that you are someone who is willing to reevaluate your, positions, beliefs, perspectives based on new data. And I'm grateful to see that. I think many of us here, probably virtually all of us, are grateful to see that, because that's been something that we haven't seen, right? So, with many of the policies that we've discussed today, I mean, basically what we've seen instead is that things work until they don't work, because now we need to shift our policy approach rather than, we think this might work, the data is saying something different, let's shift our policy approach for that reason. That would have, there would be a lot more trust in our government bodies right now if that were the case. Something else to add is that, absolutely, I think the practicing physicians, and I personally actually was working in the hospital at UCLA during the week that the governor there shut down the state. And my team treated patients with COVID during that week. And, and it is absolutely the case that we have a lot of compassion for suffering, which we see in patients in the hospital. And certainly, very unfortunately, COVID has been associated with that, has caused that. Working with my team that week, I had a team of young residents, and they were terrified. They were terrified because of the policy approach that the country had taken. And it's hard, but it is the job of policymakers to be able to rise above that, to be able to see the entirety of the field, to know that, we will do what we can Suffering is terrible. We cannot end it all, but we can't use that as an excuse for terrible, harmful policies, which many have acknowledged, have noted today, were the certain consequence of many of the choices we've made, particularly with kids. And so that's the job of policymakers, and virtually everyone everywhere has failed. We have an exception here with Governor DeSantis, but that's the entirety of the picture.
Great. Dr. Raju, what did you see during this time with your patients? How did this affect kids? I mean, the media would always talk about how this was especially dangerous for kids. They tried to scare parents. And then what were you able to do in terms of treating patients?
So I'm an internal medicine physician, so primarily I see adults. But within our practice, we do have family physicians as well. And we did not restrict our COVID testing. We also tested children. So we have seen COVID in all ages throughout this pandemic. What we've seen also is that patients are not seeking routine care. They're not coming in for preventive care. They're not coming in for management of their chronic diseases, diabetes, high blood pressure, high cholesterol. And in fact, those things have put them at risk for more bad outcomes if they do contract COVID. So we've sort of seen both what's happening in a generally healthy population, because we do see mostly outpatients, as well as detriments because of the fear of COVID to their overall health. And I will say that in children in particular, what we've seen on the outpatient side has been, by and large, mild disease. And my colleagues, pediatric colleagues on the inpatient side, have also said the same. We did see quite a bit of admissions related to RSV and COVID during the Delta wave, and that was a bit of a setback for schools opening normally. But overall, I think the data have shown since 2020 that the disease is very mild in children and young adults.
I think that raises the question of, we've seen a lot of politicization of science. We've seen dissenters punished. We've seen kind of using any type of even half-cocked study to support the narrative and ignoring really rigorous, high-quality studies that would undercut the narrative. And so I think people are wise to that now. I think people are very skeptical, but we have this issue in terms of COVID-19 vaccinations with respect to children. And in Florida, we prohibited mandating COVID vaccines for children so they can go to school, and it's a parent's decision. But you got a lot of pressure. I think Joe Biden in the State of the Union said we really want to get this vaccine so you can start giving it, to infants even, and people that are under the age of 5. And I know they're looking at that. And so, what is that in terms of a parent? How do you navigate that? I mean, Joe, you want to kind of kick that off? And because I know a lot of parents have come up to me and they're just like, thanks for not mandating. We want to make the decision, but they have mixed feelings about whether they should do that, even if it is their choice.
Yeah, so it'll be great to hear what you all have to say about this. I think just in a timely fashion, we just saw maybe a week ago, maybe less, a study out of New York that looked at, I think, kids between 5 and 11, and basically found that whatever protection that was provided from hospitalizations dropped, 50% or more after only a few weeks. So this is, and already the rates were low, scraping at the bottom of the barrel, particularly with healthy kids, in terms of actually being able to quantify with any accuracy and any confidence the even potential of benefit. So I don't know who might
go
want
ahead.
to.
So I just had a study that was published on this topic, looking at vaccination of adolescents, doing a risk-benefit analysis, which, we really should have been doing from the beginning with a larger study, considering, the disease is overall very mild for most children, that we need to make sure that the benefits of vaccinating them outweigh the harms of doing so. And, this is particularly important now that we know that the effectiveness of the vaccine against transmission to other people is small and is fleeting. So the argument for vaccinating children for the societal benefit is not what it used to be. And then we need to look at, for children who have already been infected, and we know according to the CDC that that's at least 58% of children, is probably more by now, it's certainly more by now, have already been infected, especially for healthy children. We don't know if they benefit from being vaccinated on top of already having infection, and that's actually true for adults. That's been shown with data from the CDC out of New York and California. So we need to make sure that we're not doing an overall harm by benefiting or by vaccinating children when we don't know if there's benefit. And we have this known safety signal, which we analyzed in our paper, which is myocarditis in boys, especially more than girls. It also exists in girls and young men. And so even for boys who are previously healthy, who haven't been previously infected, we didn't find that there was a benefit. There was actually overall risk of giving them the second dose. And so these are the type of analyses that we need to do in a rigorous manner. And until we know the answer to this, and until we're sure that we're not overall doing more harm than good, we need to be able to give parents and children the choice about whether or not they should be vaccinated.
What, do you agree?
Sure, I agree 100%. I mean, I think the COVID mandates have been plagued by a lack of risk stratification from the beginning. So I commend Dr. Hoag for her work on this. I mean, are we talking about children with comorbidities, those that have been previously infected? Again, I think that's at least 58.5% per the recent CDC data of children have already had COVID. So we just need to get more granularity with this. The data are out there. It's just we need to have those data released. You made mention of it before about the data being withheld. We need data out there. We need more publications like this. We need more granularity to make personalized decisions.
Dr. Malone, in terms of mandating for children, but then also, okay, no mandate, what would be the advice to a parent just based on the data that we have?
The consensus of over 17,000 physicians and medical scientists are that the risk-benefit ratio for children does not justify vaccination. Furthermore, I met with Nancy Pelosi in her office many, many months ago as the vaccines were being rolled out and specifically requested, and they acknowledged my request, that there be risk stratification by age and by risk group, and that was intentionally not done. What we have is clearly the withholding of that information by the CDC, as documented by the New York Times, no less, on President's Day, with the reveal that the CDC is withholding large amounts of data and has been doing so for the bulk of this entire pandemic, and the explicit statement that the CDC is acting as a political arm. The CDC, what we all grew up with as physicians when we were being trained, when you published in MMWR, we believed as physicians that the Centers for Disease Control and Prevention was a neutral arbiter of truth, and that they would distribute this truth so that public health officers and physicians all over the United States could make informed decisions about how to manage infectious disease outbreaks and other public health risks within their own communities. And under this administration, we have seen that policy completely upended, and explicitly the CDC is acting as a political arm. It has weaponized public health for political purposes on the part of the federal government. Furthermore, Governor DeSantis, as you know, we now have, because of Freedom of Information Act, the reveal that the government, this administration, this executive branch, has invested over $1 billion in promoting these narratives in social media and in the legacy media. It's not mere circumstance that we've been constantly bombarded by what is essentially surreptitious advertising, promoting vaccines across all age cohorts. This isn't circumstance, this isn't chance, and we don't have to evoke conspiracy theories. We have the clear evidence that the government has invested over $1 billion in basically marketing vaccines to your citizens and the citizens all across the United States.
Dr. Kaldorf, you've, with the Great Barrington Declaration, you and your colleagues were one of the big critiques of the Fauci policies was there was no appreciation for the different levels of risk based on age. And so you do not want to be imposing policies on younger people who are healthy and who can help build herd immunity. You want to focus on nursing homes and other things. And I think that you had the same view on the vaccination to prioritize the elderly for that. How do you view this issue in terms of the vaccinations of the kids? I know there's some jurisdictions in the United States that are forcing COVID vaccines for kids in order to attend school. Florida, we've prohibited that practice. But just as a general matter, how do you see the vaccines in relation to children?
Yeah, I think vaccine mandates and vaccine passports are damaging. They are unscientific and they reduce the trust in vaccinations. So if you're 75 years old and you haven't had COVID, then I think it's a no-brainer to get the vaccine because you're high risk, even if there's small risk with for the adverse reaction. That's much less than the benefit from the vaccine or preventing death. For children, the story is very, very different. And I think in public health, it's important to be honest, not only about what we know, but also what we don't know. So if you go back and look at the randomized trials for children of the Pfizer vaccine that were used for the emergency use authorization, what those trials showed, and they had about a little over 4,000 people in total, kids in total in these two trials. What these trials show is that there is a reduction in mild infections. But if you look at serious disease, the hospitalization and death, there was none of those in the vaccinated group, and there were none of those in the unvaccinated group. So, and that's because it's such low risk for children. But therefore, these trials doesn't tell us anything about whether these they protect us against what we really want to be protected against, which is death and hospitalizations. Also, they showed that the trials showed that there was a reduction in mild disease for about a couple of months. And as Joe Ladapo said, there's this new study from New York State that shows that this wanes after a few months, just like it does for adults. So that's not a surprise. So there's really no hope, I think, that these vaccines can prevent people from getting disease. They will eventually get it. And there's a big question mark about hospitalizations and death. The New York State study didn't look at death either, because even though they had 1.2 million children in that study who were vaccinated, there was still, and I think about 38% of the total in those age groups were vaccinated in New York in the study. There still was very few deaths in the whole state to evaluate that, or for some reason they didn't look at the death. They did look at hospitalization and saw a reduction in hospitalization, which also waned over time, but it's still very difficult to evaluate whether that reduction is due to actually hospitalizations due to COVID or if it's hospitalization with COVID. They weren't able to distinguish that. So we still don't really know if this vaccine reduces hospitalizations. So in summary, I mean, a lot of kids have already had COVID. They have immunity. If you've had immunity, you don't need vaccines. And that by itself sort of reduces any argument for having vaccine mandates or vaccine passports. But for children who haven't had COVID, there are question marks. We don't know to what extent it helps against death and serious disease. And right now in the US, the Omicron wave is going down. So right now, I think the benefits of vaccinated children are very small. And as Tracy Hög was saying, we know that there's a risk of myocarditis for especially young boys and young men, but also for girls. And there might be other adverse reactions that we don't know about yet, because that can take a couple of years before we find out those things. So for children, the benefits we know is at best very small, and the risk we also know is at worst quite small, but we don't know what the risk-benefit ratio is. So I think under those circumstances, it's unethical to mandate vaccinations for children.
Great. Joe, you want a final thought before I wrap it up?
Yeah, well, thank you. Really, thank you for everyone who is.
Do you mind if I quickly follow up on Dr. Kuldorf for a moment there?
Sure.
Is that okay? Just quickly. I mean, this is something I've been working on here for a while with just harm benefit analysis in these COVID vaccines. And just for parents who are trying to decide on what they should do, I just want to lay this out quickly. The first thing that you want to do for harm benefit analysis is there a mortality benefit for these vaccines for your child? And the majority of studies haven't been able to find a single healthy child who's died from COVID. The studies that say they have found them, they can't confirm that they were healthy children. So now the question is, if you have a child who's at risk has risk factors for COVID, that's a discussion with your pediatrician. But if you have a healthy child, the chances of that child dying are incredibly low. It's essentially close to zero, if not actually zero. Then the next part of the analysis that you would have to think about are the side effects of the vaccine and the symptoms of COVID. The vaccine causes severe symptoms in children. In adults, it takes people out of work for a couple of days. If kids have to get a vaccine every 6 months or a year, and that's the guarantee, they have to get it every 6 months or a year, you compete that with getting COVID maybe every couple of years. That is not a clear benefit of a vaccine here. Normally, we have a regulatory drug body that investigates this called the FDA, except they didn't do an investigation to figure out how much this vaccine stops symptoms. They only looked at antibodies. They didn't look at any symptoms. This is unexplainable. We can't excuse them for doing this little on this. And then the next part that was brought up was transmission. We have no idea if the vaccines reduce transmissions in kids or in adults. The FDA could have required this as part of their studies. Who in the family, in the people who were in these studies was getting infected? How often were they getting infected? They did not require this at all. So now we have no information on symptoms, transmission, death in children, or we don't have information on hospitalization either. And that's true for adults as well. And this is a disaster of our drug regulatory body of the FDA. And I am sorry, I'm sorry to be old school in that I like clinical studies to dictate what we should be recommending to make our clinical decisions. And I'm sorry that the FDA has not lived up to their classical role of doing that. And I just needed to let that out there. I'm sorry.
Thank you, and I think that'll be helpful for a lot of parents, as they look to this, because I think there's certainly from mass media and stuff and saying that somehow that this is something that you absolutely need to do. So, final thought before I wrap it up.
I think Dr. Freeman, you actually provided the introduction to our announcement, which is the Florida Department of Health is going to be the first state to officially recommend against the COVID-19 vaccines for healthy children.
Okay. Well, thanks. I just want to thank everybody for being a part of it. We have a lot of people, I think a couple hundred folks on our virtual panel who are involved in medical and healthcare from around the country. We also had some great panelists participating on Zoom, and of course, the wonderful folks that we had here. Thank you so much for being able to do it. And look, I think that this discussion has crystallized a lot of things I think we've seen. I mean, you have this lack of trust in the medical establishment and in the CDC. And the politicization of those institutions, and that's not going to bode well for us as a society going forward. An aversion to actual data if it conflicts with the narrative, and then really a failure to weigh costs and benefits, whether that's lockdowns, whether that's school closures, or whether that's even something about whether a healthy 7-year-old kid should get the COVID vaccine. So I appreciate all the insights, and thank you for participating for this roundtable discussion.
Wow. Okay, no sound. Are we there? Looks like I might have bumped something. Okay. All right. Let me see if I can start over again. There are some things going on in the world right now that are going to make the history books besides COVID. When this country was founded, years and years and years ago, it was the product of hundreds of years of habitation. Hundreds of years. The Pilgrims, 1620. The Spanish, 1565. It wasn't until 1789 that this country had a constitution. And it was only 13 colonies at that time that were saying that they were independent. Florida wasn't even part of it, by the way. And the rest of this was just this giant unknown. You had the French, you had the Spanish. In 2 years, in 2 short years, Florida has now become the center of the free world. It has shifted from Washington, D.C. to Tallahassee. That conference included people from all over the globe who are now looking to Florida as the leader of the free world in 2 years. If I had made this comment 3 years ago, 4 years ago, 5 years ago, that Florida was going to be the place that the entire world turned to see the direction, people would have laughed at me. They'd say, what? People are going to go to Disney? What are they going to do? They're going to go to the beach? What? Are they just going to watch people be crazy? See, that whole part about Florida Man, that meme that people like to laugh at about Florida Man, that's the result of unbridled liberty and freedom. See, if you want peaceful order all the time, that's a sign of tyranny. Now, we are a law and order state. We don't tolerate nonsense. But people are free. And people have liberty. And it's a culture down here where when people say, you must do this, you must do that from Washington, D.C., the first response is the middle finger. Okay, you might think it's a good idea, Washington, D.C. We'll take it under advisement. Now go jump off a bridge. That's not like just the crazy people in Florida. That's all the people in Florida. That's just kind of what Florida's about. In fact, that's why people laughed at Florida. Because, there so many people would just go off the rails with that and completely lose their mind. It was up to Floridians to decide, what we wanted to do. And it's why so many older folks come here, because they come from a different era. I mean, yes, it's warm. Yes, it's sunny. Yes, it's all this kind of stuff. But the real story behind what you just saw, the real subtext, is that regardless of everything Washington, D.C. has tried, under 2 presidents, by the way, has absolutely failed to move the needle in Florida. In fact, it's moved it the other way. We're now far more independent, far more liberty-minded, far more inclined to just not listen at all to what's coming out of Washington, D.C., period, for any reason. And this is what has them flummoxed, and this is what history is going to remember. I'm kind of a big history buff, and I look back at how long it took to make this country. It took hundreds of years. It really did. From 1620 to 1789, was it 170 years? I mean, how many people came and went? How many lives? People lived entire lives in the New World as, citizens of a British colony or citizens of a Spanish colony. And that doesn't even go back to when St. Augustine was founded. St. Augustine was founded in 1565. And even by 1789, which is 200 and something odd years later, when the Declaration of Independence and the Constitution was put in place, that's centuries went by, and Florida was still not part of America. It was only the 1800s. It is the oldest continually inhabited European settlement in North America. There is one city in Venezuela, believe it or not. It's in Venezuela, that was established by the Spanish in 1513. So it's about 50 years older, on the northeastern coast of Venezuela. But it's the only one in in all of the Americas, European colony, that's older than St. Augustine. And I think that has a lot to do with what we just watched. It really does. It's a culture shift. Yes, the isthmus of Florida, the peninsula of Florida, is attached to North America, but right now, we might as well be Brazilians. We might as well be a Caribbean nation. I mean, literally, this now is the world we live in. Because even you go up to Atlanta, even going north to Atlanta, you see an entirely different culture, an entirely different way of thinking and believing and acting. So it's, and I just wanted to touch on something with the gardening people were talking about. Florida is kind of freaky in the sense that you can literally try to not grow things, and they will grow anyway. There are plants that I thought were dead, completely dead, and I tossed them out in the woods behind the house here just to put on, a stack of, stuff to get rid of. And I go out there 6 months later, and it's sprouted. And it's healthy as a horse. It was doing better laying on the ground out in the woods behind my house than when I was trying to take care of it. So it's kind of weird. We might be back on Twitch, by the way, here maybe tonight, tomorrow night. And I was going to put up a poll and see which game people would be interested in. There's a Assassin's Creed Black Flag. Those of you who didn't watch us play it through the first time. And the entire game, Assassin's Creed Black Flag, the map you're looking at right now is the map for the game. It's Cuba, Jamaica, Haiti, the Dominican, Puerto Rico, the Bahamas, and southern Florida. You take a ship and you sail it all around here. This is the West Indies, by the way. For those of you wondering about the series, Black Sails, that I use as a reference over and over and over again in my YouTube videos. It's not my super green thumb. Absolutely not. But the series Black Sails is basically the Bahamas. It's 4 seasons, and it takes place in the Bahamas. There's some scenes in Havana. There's some scenes, I believe, in Haiti. There's a Port-au-Prince scene, Havana scene, the Turks and the Caicos, the Antilles. It's a whole game centered around basically, and a lot of it, you start really up near Florida where Miami is. So anyway, so thought maybe we'd do a playthrough again of that. And I will warn you guys, by the way, if you do go get the series Black Sails, the first season, you probably should have the kids in bed, for sure. Especially the first, I'd say probably 4 or 5 episodes. So, I guess we'll just leave that there, but it's crazy. If you have anywhere around you that where cedar trees are, I've noticed this. For some reason, the ground around cedar trees is incredibly conducive to growing things. And yes, the stream will be uploaded. All of them are. It takes some time. Yeah, spicy's a little more than spicy. But where was I at? Cedar trees. Cedar trees. Let me see if I can update my my chat monitor is like way behind here. Okay, there we go. If you have anywhere around, like if you see a wooded area where there's a couple of cedar trees, and go dig some dirt out around. I mean, don't take a whole ton, but take a couple of bags, maybe 5, 10, 15 gallons of dirt from around a cedar tree, the base. You will be amazed, and mix it into your garden. You will be stunned. I have grown I love avocados. A lot of people do. Make guacamole. The pits, the seeds, the avocado seeds. I have probably started 25, maybe 30, just by putting them out there underneath the cedar trees. I'll go scrape up some dirt. I'll throw them a couple inches down, and it's literally a matter of weeks. They even came up over the winter. I have more fully grown, well, not fully grown yet, but completely started avocado plants than I know what to do with. I have one that is getting close to 5 feet tall, maybe 6 feet tall. And I grew it from a pit that I bought I bought avocados at the local farmer's market. Honestly, I think they're red cedar. And I've been very blessed right behind. In fact, maybe I'll do a live video out there. I have 2 huge, absolutely enormous 40-foot, maybe 50-foot cedar trees in the right behind the pool enclosure out in the woods, right at the edge on my property. And tons of shade out there, tons of needles and all that kind of stuff too. But it's insane. It is absolutely insane. I couldn't believe it. I tossed those out there. I thought animals were going to get them. And I go out there and I'm like, what are all these things that are sprouting? Because the leaves are very unique. And I dug them up and I'm like, and there were the pits. I'm like, these are all avocados. It's insane. And the one that I started, and it's not even a year ago. I mean, it's almost a tree. It's almost a straight up tree at this point. It's taller than I am. And I have some others that are about, 3 or 4 feet tall. And then I have probably, 10, 12 at least that are, 6 to 8 inches tall. I mean, everything grows out there. Everything. And they were sprouting in December. That's the crazy part. They were coming up out of the ground in December. So anyway, maybe I'll do that. Maybe I'll go do a live out back and show you what I have. Now that I have the fence up, that was a lot of work there for a couple of weeks. Got a fence around the whole back. I've got strawberries going. I've got eggplant going. I've got avocados, tomatoes, peppers, corn. Yeah, funny story. I had left some sweet corn cobs out to dry to get the seeds to dry. And little animals love corn. They can smell it a mile away. And I'm like, it's the middle of the night. I'm like, what in the world's going on in my backyard? And there was this giant fight over a dried ear of corn. A couple of squirrels were taking turns stealing it from each other. So anyway, don't leave ears of corn laying out to dry in the sunshine so that you can get the seeds from them. If you have and there's no fence in the world that I've ever seen that ever stops squirrels. They absolutely love mine. At this point, it's a 6-foot solid wood privacy fence, and they run sprints all along across top of it. So anyway, so I guess I will leave it there. We're pushing on 2 hours now for a live, and that's actually a lot for YouTube. So once I stop the live stream, it takes a bit of a amount of time for YouTube to process the whole thing into an actual video. So if you can't go back and watch it, don't think I've deleted it. It's just going to take usually no more than an hour, and the whole thing should be back. So anyway, God bless. Thank you everyone for being here. I very much appreciate it. Keep your eyes open. We might be back on Twitch tonight. Also, thank you everyone who has signed up at Patreon. If you could, like, share, subscribe, sign up. $1 US. It's only one. It's less. A lot of people are doing that, by the way. They're signing up for the annual, and it's $10 and some odd change for the annual. And like I said, you sign up now in March of 2022. You won't have to worry about rebilling till March of 2023. And we're going to have a brand new video up there in the next week or two, because there's two other things that are going on too that have directly to do with Russia and Ukraine and the U.S. military, and why they're not using the U.S. military. There's a reason, a big reason that nobody is seeing. So anyway, we'll leave it there. Once again, pray for each other, lift each other up, keep your head on a swivel, and we will see you guys next time. Take care.